Hi everyone, it's Dr. Cole. I had another incident with a patient here where we were discussing antibiotics. And I wanted to just come on and film this because there's so much misconception out there about what is too much in terms of antibiotics and what they do in the body. You see, what I ask my patients is this. I say, if they have gut problems, do you have a history of taking antibiotics? And you'd be shocked. The average person is going to say no. They don't, because they don't think of it that way, right? And then I get into it with them, and I just ask this patient. I said, in your adult life, have you taken more than 5 bouts or rounds of antibiotics? And she's like, oh yeah, absolutely, more than that. I was like, wow, like you don't think that that's like a lot? No, I was never really thinking of it that way. And I said, well, here I'm 59 years old, and I know for sure that I've not taken any antibiotics for at least 40 years in my life. And to me, that's more normal, but I get it that to the average person it's not, especially to females. Most women have this history, and I did wind up asking her, like, how many would you think you've had in your adult life? And she said, well, maybe 15. And I'm like, wow, like that is so different, right, in terms of her perception versus mine. But what I went on to explain to her is that these antibiotics, they're like the nuclear option. They don't just go in and kill off your bad bacteria. They kill off your good bacteria in your gut. And over time, what happens is when you add in antibacterial soaps that so many of us overuse, and you add in the antibiotics that are in our food supply, you can quickly see how we are just decimating our internal ecology, what we would call our intestinal flora. And when these good bacteria become wiped out, it's a breeding ground then for bad bacteria to proliferate, to increase in number. And it's a condition that we call dysbiosis. And when you have this abnormal ecology, too many bad bacteria, not enough good bacteria, then you start winding up seeing the symptoms that we see: constipation, bouts of diarrhea, acid reflux. These things all matter, and now we're finding out more and more about the health of our gut, and as it relates to our immune system, as it relates to the function of our body, even things as far away as your brain function. We know that there is this gut-brain connection. And if you're the type of person who has maybe had too many antibiotics in your life, too many herbicides, too many pesticides, and you've damaged your gut, ultimately that can even impair your brain, and you wind up with anxiety or depression or brain fog, short-term memory loss, the inability to sleep normally. You can't fall asleep, or if you do, you can't stay asleep if you wake back up. So these things are all brain issues, but they have their roots many times in an unhealthy gut in our body, and that is oftentimes the result of just this onslaught of antibiotics that we have faced over a lifetime. Many of us, just too many to even remember or count. And then, like I said, when you add in these other factors like our food and the antibacterial soaps, it's just overwhelming. And then finally is that what happens is this damage to the gut causes something called leaky gut syndrome. And leaky gut syndrome is where you are eating your food, but they're not properly digesting it, and it's passing in a damaged gut that actually has micro perforations or little holes in it because of the lining, the damage to the lining of your gut. These undigested foods are passing into your bloodstream. They're causing an immune system response. It creates chronic inflammation in your system, and it ties directly back to the inability of your thyroid hormones to get into the cell and to do their job. And it's really the reason why so many women are stuck, they're sick. They have no explanations. The doctors are giving them no answers as to why they can take their hormones, but they never feel normal again. They can't lose weight. Their brains are messed up. They have no energy. Their gut's bad. That whole long list. Because we know that thyroid hormones create metabolism in all of the cells of our body, and when you have depressed metabolism because you don't have thyroid hormones getting into the cell, then it manifests itself in abnormal function in our body. So again, I hope this helps you. If it does help you, you do us a great favor by passing this stuff along. We're trying to build a community here of people that are sick and suffering. We believe we have answers, and you help us tremendously whenever you pass this on. Take care.